Hi, everybody. It's Lisa Tversky, co-chair of the upcoming Nefesh International Conference this coming January 7th through 11th, 2026. And it's that time again to hear from some of the presenters who you can look forward to encountering and hearing from at the conference. I'm here now with Dr. Robert T. Muller. Thank you so much for doing this, who is the author both of Trauma and the Avoidant Client, as well as the book Trauma and the Struggle to Open Up. And as you can guess, he is one of the preeminent, if you don't know the name, presenters on trauma. And he's going to be giving us a workshop, two workshops actually, Sunday of the conference. And we're here to talk with you first about when the relationship goes off the rails, countertransference and relationship ruptures in trauma work. Welcome, Dr. Muller, and let's
Thank
hear
you.
what we can expect from this workshop.
Okay. So I will try to be brief, which is difficult as a professor, but I will try. Um, Essentially, with that workshop, there are two sections to it. The first will be focusing on countertransference patterns.
Mm,
And specifically, what are the countertransference? What are the ways in which the therapist's feelings about the therapy and the client tend to come up? Which feelings come up in what situations with different kinds of trauma clients? And we, as therapists, are generally quite aware that the idea of the rescue fantasy is very common. So that's one example. The idea of my client is vulnerable. I'm a
mm,
caring, nice person, so I'm going to try to take care of their problems for them. That idea is very common
mm,
and has been talked about in a number of studies and in clinical work. But there are many other countertransference patterns that tend to get in the way,
mm,
and that are would be really helpful for therapists to know about. Some of them are more subtle than others. So this workshop, of course, I'm assuming everybody coming to it is already a good therapist. This is not, don't do, really strange things or whatever with your clients. This is
right.
obvious most of the time for most
Mhm,
good therapists. I'm
right.
assuming we're talking about therapists who know what they're doing. And so for therapists who are very used to doing good work, what are
Mm,
nevertheless the things, the feelings that are subtle that can come up and actually show themselves in ways that you don't realize are getting you into some kind of difficult situation. So
mm,
that's the countertransference patterns issue. The second part of the workshop is what happens. It's is really about ruptures and enactments and ruptures, and then
mm,
how to get the relationship back on track once you've had a therapeutic rupture. So really
mm,
specifically looking at, let's say you've done your countertransference work and still you don't realize it, but you step into some kind of enactment with your client. So what does this look
mm,
like? I sometimes use the example of the guru enactment because that's a very common one with
mm,
therapists,
mhm,
where the client comes to you week after week and says, what should I do about this? What should I do about that? And you step into a pattern of, rather than being their therapist, becoming their guru.
mm,
Um, oh, yeah, Kelly, I think you should try doing this. Oh, well, how about that? And kind of giving advice so that you shift away from helping the person become the architect of their own future. And rather than doing that, becoming their guru, a nice person, a caring person, but nevertheless disempowering them and infantilizing them. So that's
mm,
just one example, but I'll
yeah.
have many examples of how this can happen and more
Mhm,
subtle examples as well, where you step
mm,
into some kind of enactment and then actually break boundaries again unwittingly. We're talking
right.
about good therapists here who
Mhm,
might, so the examples are all with good therapists. How
right.
might you step into a pattern and unwittingly cause some kind of rupture in the relationship? And
Mhm,
then once there's a rupture, how to get the relationship back on track and what to
mm.
do about it and how to be able to help them
So
so that
important.
you can work through that. So that's really what the workshop is about.
That's So important. It's so, so important, especially, well, I think in any work, but trauma work gets very, very tricky.
Yeah.
How would you say this informs, or is there in your mind a difference or something that's added or something if there's specific modality work being done, EMDR work, somatic work? What would you say? Is this, it's all the same, it's different, it's how do you see that?
So different modalities do encourage us to use different parts of our mind. And, therapists who are more comfortable with emotion focused therapy will have a certain kind of attitude toward the therapy. Therapists who are much more CBT oriented or EMDR, et cetera, psychodynamic, family therapy, you're going to have a different way of thinking about things for sure. But really, my goal with this workshop is to help people think about these relational issues that come up regardless of the modality that you use. And I
Mhm.
find that these issues are not really modality specific. They
Yeah.
come with the territory of working with trauma clients. They come with the territory of having very vulnerable people who are in great distress, who want you sometimes to fix their problems. Sometimes
Mhm.
they're low on insurance and they want you to do it quickly.
Right.
Problems that have been years in the making. So there's a lot of pressure on the therapist, and yet there's a lot of work to be done. And so it's very easy to fall into certain patterns with different
Mhm.
kinds of clients, especially imagine clients with personality disorders, whether you're doing EMDR work or whether you're doing psychodynamic psychotherapy. With a
Mhm.
client with a personality disorder, it's the interpersonal struggle that really um, uh, can get you into hot water. And so how does that happen? How does that look? It'll be relevant for therapists who work in different varying modalities.
Yeah, very much so. Very much so. I know I'm looking forward. So
Mm.
we are very close, but to the conference. Everybody should be getting out and registering January 7th through 11th. And we're going to have two workshops with Dr. Robert T. Muller. And we are looking forward to both of them, and you'll hear about them as well. And thank you all for your attention.